Good afternoon. I'm Dr. Jazz Atwal, Manitoba's Deputy Chief Provincial Public Health Officer. As of 9:30 a.m. today, 143 new cases of the virus have been identified since last Friday. This includes 62 cases on July 17, 44 cases on July 18, and 37 cases today. The current 5-day COVID-19 test positivity rate is 3.6% provincially and 3.1% in Winnipeg. And since last Friday, one additional death has been reported. I wish to extend my sympathies to the families and loved ones of this individual. In a post-pandemic Manitoba, we will see public health guidelines, not orders. We won't be reporting daily case counts, and our health system won't be overrun by a single cause. We have the power to make this happen through vaccination. But we will have to remember that the virus that causes COVID-19 will likely continue to be present in our communities even after the majority of Manitobans are fully vaccinated. We need to learn to live with COVID-19 like other respiratory illnesses. We need to assess the risk and determine what activities are comfortable for us and where we may need to take more precautions. Individuals who are at greater risk of developing severe illness or who spend time with individuals at greater risk should carefully consider how they interact with others. This includes continuing to use additional precautions, such as masking and physical distancing. A few key things to remember. Outdoors is lower risk than indoors. When indoors, try to keep windows and doors open. Good ventilation helps reduce the risk. Smaller group sizes are lower risk than larger group sizes. Fewer contacts is lower risk than many contacts. When getting together indoors or outside, where you're not sure of everyone's vaccine status, try to maintain 2 meters of physical distancing. And unvaccinated guests should continue to wear masks and practice physical distancing for their own safety. We know some Manitobans might still be hesitant to get vaccinated. If you have questions, please talk with your healthcare provider or seek out credible information. I cannot more strongly recommend getting the vaccine to not only protect yourself, but to protect those around you, your loved ones. And I am thankful for the important grassroots work happening in every corner of the province to help connect people who face barriers to access the vaccine. Businesses and organizations are providing the vaccine to their communities. Immunization clinics are being held in provincial parks, and every day the number of fully immunized Manitobans is increasing. Manitoba is now one of the leading provinces in Canada in the number of fully immunized people, and we're getting closer and closer to getting back to a sense of normal. I encourage everyone to get vaccinated with 2 doses to make sure you and our province are fully immunized against any COVID resurgence. If Manitobans continue to get vaccinated and follow public health orders all the way through, I'm confident we can and will reopen as proposed. Thank you, and I could take questions now.
Thank you, Doctor. Up first today from Global, Joe.
Afternoon, Dr. Atwal. I'm just wondering about getting tested. Should double vaccinated people still be going for tests?
Yeah, I mean, if you have respiratory symptoms, if you have symptoms that you are worried about a respiratory illness, or you check into the website and you click on your symptoms and it recommends you go for testing, even if you are fully vaccinated, you should still go for testing and self-isolate until that test result comes back.
How common would it be to test positive after having both shots? Like test positive, maybe not have the serious outcomes, but still test positive if you're double vaccinated?
So we know the risk of getting COVID is rare once one is duly vaxxed. So once you've had 2 doses of a vaccine, is 2 weeks past that point, if you develop respiratory symptoms, you get tested, most likely you won't have COVID-19. We know vaccine effectiveness or efficacy is close to about 90% with the vaccines that we're using. So we're looking at our data, and our data seems to show that as well. And we're doing some greater analysis on our data related to cases that are being generated and those that are duly vaxxed. But for the most part, the vast majority of our cases still are happening in those who aren't vaccinated.
From the Brandon Sun, Colin.
Good afternoon, Dr. Atwal. You said during your opening remarks that you encourage people who may be hesitant to get the vaccine to reach out and ask more information if they're unsure. Are people taking you and your colleagues up on that when you say it? Are people calling and asking for more advice?
Yeah, I think, from when we hear from the healthcare system, from people in public health nurses, primary care providers, pharmacists, we've heard anecdotally, this isn't everyone letting us know what's occurring, but what we're hearing are, people are asking questions. They are making appointments to talk about the COVID-19 vaccine, some of the concerns they have with that vaccine, and working with those practitioners and those individuals to really become educated on the benefits of the vaccine and what it can mean to one's health and protecting other people's healths around them as well.
I see in today's COVID bulletin, it says that all the patients who were transported out of province for ICU care have now been returned. How helpful was those other provinces' support as we faced the worst of the third wave of the pandemic?
That's a great question. It was profoundly helpful. We thanked those provinces, and we'll continue to thank those provinces for helping Manitobans out and helping the Manitoba acute care system out when it needed that help. So we were, significantly impacted by the number of ICU admissions that occurred. We reached out to provinces, they reached out to us, and we were able to create a very mutual relationship to help these individuals out. And it was a good experience, I think, to learn about the system, learn about working with other jurisdictions as well. And, again, we want to thank those provinces for helping out Manitobans. And we want to be thankful that, those Manitobans are now back home and that we don't have anyone outside of the province right now as well.
Up next from CJOB, Rosanna.
Hi, Dr. Atwal. Thanks for taking our questions. I was wondering, could you give us a sense of what the fall will look like with colds, the flu, and COVID-19 circulating? Will we see as many COVID-19 testing sites available, and how long will they be open?
Yeah, so that's a tough question to answer. So when we're looking at fall, if you look at sort of what life will be like at the end of September, what our response will be with COVID, with other respiratory illnesses like influenza or RSV, like you had mentioned as well. We sort of alluded to this on a number of occasions. We're working through that process on what the public health response will be from a COVID perspective, from an influenza perspective, how we manage cases and contacts. And we have to, understand where that risk lies, what that risk might be. So we're still in the early stages. We've been working on this for a period of time, but we're still working through it right now to really ascertain what that looks like in the fall. So when more definitive decisions are made, when we've decided on, what things will look like from a case and contact perspective, from a testing standpoint, we will provide that to the public for sure.
Great, thank you. And we have heard of people trying to use fake vaccination QR codes or sharing them with others. Do you have an idea of how widespread this is, and how are you tackling it?
I just heard about it this morning. I don't know how widespread it is. I've heard of anecdotally one situation. I'm sure there's more than one, but that's something we're going to have to take a deeper look into. So I don't have much more information on that.
From the Winnipeg Sun, Glenn.
Yes, Dr. Atwal. Today, the NDP are calling again for the release of the Delta modeling data. Can you comment on that? I understand this is doctors, I think it was Doctors Manitoba, has also asked for it a few weeks ago. the value, or can you comment on the possible release of the Delta modeling data?
The last update I have is, that model is still being created with the Delta variant, with vaccine uptake and the newer information that's available from around the world in relation to risk. So we're still looking at other jurisdictions and the rate of risk associated with those who are vaccinated and those who are, getting together more closely now, even in outdoor settings. So I don't have an update on when that model will be available. I know it's being worked on at the present time. I just don't have a date on when it's going to be available.
You seem to indicate in your opening the sort of, sorry, I'll rephrase that. Are we starting to get a picture of what the new normal is going to look like? You seem to indicate a little of it in your opening remarks about how we're moving to, we have to, I don't want to say accept that COVID is going to be with us in the long term. Are we getting a picture of what the kind of new normal is going to look like once we get through the worst of the pandemic?
Yeah, that's a great question. So what we're going to have COVID. When we hit our vaccine targets, there's still going to be COVID floating around. We're going to have a lot of unvaccinated individuals as well, for various reasons. For age is one, and once young individuals are available to or authorized to get the vaccine, once Health Canada approved, they'll be able to get vaccinated as well. But not everyone's going to get vaccinated. We have variants out there as well, and we know the vaccine isn't 100% effective as well. It's about 90%, 88% effective once you have 2 doses. You're 2 weeks out from that dose. So for society to kind of keep moving forward, for us to kind of get back into some sense of normalcy, which is, we're taking those steps right now for that, we're going to have to learn to deal with COVID, just like other illnesses that cause hospitalizations, that cause ICU stays, that cause illness as well. So things like influenza, things like RSV. And coupled with that is, we're going to have a period of time here where, once we loosen restrictions, we're going to start seeing those other viruses as well. Not right away. They're typically happening in the fall time or early winter time, but we're going to see a resurgence of those viruses because they've always been around, and every year we know people get sick from those viruses. So with COVID, we're expecting the same thing. People are still going to get sick from COVID. Most people will have a mild illness. Most people will be vaccinated, so they might even prevent themselves from getting an illness as well. But there are those who will have a severe outcome requiring a hospitalization or an ICU stay, just like we have with influenza and just like you have with RSV, let's say. So, in dealing with COVID, we're looking at how life would look like with dealing with all these respiratory illnesses. And we don't have final answers yet here. We're working our way through it from a public health perspective and how we're going to manage these different viruses all together, how we're going to manage cases and contacts, how we're going to manage risk to the acute care system. So there's still a lot of work that needs to get done there, but we need to start to normalize COVID to some degree and make sure that we're comfortable knowing that COVID's out there, knowing there are individual choices people can make. There are going to be recommendations from public health, but there are still choices that you make on your interactions and what you do and how you behave with others to mitigate risks on your own as well. So that's the direction I think we're going in towards. And we're going to be slowly taking those steps to go towards that direction as well.
From Radio Canada, Zoe.
Hello, good afternoon, Dr. Atwal. The WHO asked not to vaccinate children under the age of 12 for the moment. Do you have any concerns or plans, when schools will resume in the province? What do you do if children are not vaccinated?
Right. So, the vaccine right now, the Pfizer is available for those 12 and up. We're looking at, there's other studies being done for those younger than 12 for getting approval to get Health Canada approval or WHO approval, et cetera, to get those authorized for those under the age of 12 as well. So we're thinking that will probably happen in the fall. That's what we're hearing. And when it happens, it happens. So we are working through, from a public health side, how we're going to be managing school-age kids, let's say, in school settings, so specific to school, and how we're going to manage cases within a classroom or cases in those who are vaccinated if you're over 12 versus unvaccinated. So we're just working through that process. We're seeing what other jurisdictions are doing as well. So we've reached out to our other provincial partners, and we meet with them regularly, and everyone's looking at the same thing. And everyone has some ideas right now, but I think in a few more weeks we'll have a better understanding of exactly what we're going to do from a public health perspective in a school setting with cases.
Thank you for that. And on another subject, you touched on that a little bit, but what if people use another picture of a QR code to show that they are fully immunized? The name appears, but the businesses can't verify if the name matches the person. Are you counting only on the goodwill of people?
So the QR code, we're expecting people to take what's necessary to make sure that, someone is providing credible information. So verification of a name with the photo ID doesn't sound unreasonable to me as well. So this is something new that's come up. We just heard about it, so we're gonna work through this. We're gonna have some meetings about this and see what we can and what we would recommend through this from a public health standpoint, and that information will be shared once we finalize that.
From CBC Manitoba, Bart.
Hi, Dr. Atwal. The decision to send ICU patients out of province was a relatively last-minute stopgap when the ICUs got overwhelmed here. This province decided not to have a triage protocol approved, and it didn't have a means of dealing with all the ICU patients. Can you comment in retrospect, now that this out-of-province emergency process is over, can you comment in retrospect on how bad things got that you had to send 57 patients to ICUs in 3 other provinces?
Well, obviously it got bad. We ran out of room here. This is what we were talking about on a regular basis, the risk to the acute care system based on case generation, based on interactions, based on not following the orders, based on not testing. There are issues in communities with housing, et cetera, that cause lots of cases as well. So there are some things we can control. There's other things we can't. We've always had low ICU capacity. It's not just Manitoba. I think across the country, ICU capacity is limited, and there's a lot of work being done on this since the beginning of the pandemic to try to increase that capacity. For every bed that you increase, that's one more person that you could take care of. But that costs a lot of manpower. That's the big issue here, is the number of people required to take care of one person in an ICU bed. Coupled with that, we have limited resources on personnel that are graduating and recruitment and retention. So there's a lot of issues at play here. And we're not the only province trying to increase ICU capacity or has been trying to increase ICU capacity. Every province is sort of in the same boat. So again, we ran into an acute care issue. We ran into an ICU capacity issue. Manitoba, again, was a little bit more disproportionately impacted on the number of people on a rate basis, so on a per population basis, taking into account population differences and the number of people entering into ICU as well. So our data is a little bit more extreme than others, and that was a little unexpected. So that played into that as well. So we're going to continue. I know Shared Health is going to continue to build that ICU capacity as well. And that work is ongoing, is going to continue for the long term.
Thank you for that. What's public health's plan for the extremely likely eventuality that we have a very bad Delta wave circulating in low vaccine uptake areas like Stanley Health District, currently at 20% first dose, like Winkler Health District, currently at just over a third?
So from a public health perspective, I think, again, the vaccine is the most important way to protect oneself and one's community, to prevent that severe outcome, to prevent that, issue on the acute care system side. So, we're getting that vaccine out. We're trying lots of different ways of working with local community groups, organizations, going into remoter areas to get that vaccine out to people. We're working with, again, local leaders, providing education, and we're going to continue to do those things. And that's going to be nonstop. And we're going to focus in on those lower vaccine uptake areas to get the vaccine rate propped up there as best as we can. So we are monitoring the situation. We're also monitoring, where hospitalizations are coming from, where ICU stays are coming from. We still know in the last week we had roughly 35 hospital admissions. Again, this isn't about blame. This is just showing the power of the vaccine. 77% of those people admitted to hospital never had a vaccine, right? So that's how powerful it is. Like, we're not seeing people with 2 doses post 2 weeks essentially coming to hospital. They might get sick, the odd one, less than 1% chance of coming to a hospital in that situation. But for the most part, we're seeing unvaccinated people coming into ICU and coming into acute care system. And we're also seeing those who interact with others that are at risk. So, you might have a parent who's at risk, who is vaccinated, and you might be that child or a friend who isn't vaccinated, and that's how that vaccinated person gets exposed to COVID-19. So that puts that vulnerable person at risk. So we need to be cognizant of that. That's going to cause a hospitalization. That's going to cause an ICU stay. That's going to cause a severe outcome. So again, it's not only important to protect yourself against COVID-19 with the vaccination, but it's very important to protect those around you, the ones you love, the ones you want to protect, the ones you've always wanted to protect. The best way to do that is to get vaccinated and get 2 doses in you.
From the Canadian Press, Kelly.
Now that a lot of people have been double dosed and don't need to isolate for 2 weeks after they return to the province, what advice do you have for Manitobans that are going to other provinces like Saskatchewan or Alberta for summer holidays, where they've lifted more or less all the restrictions and there's large gatherings like a stampede?
Right. So, you still want to practice fundamentals. If you're sick, you might be duly vaccinated. If you're sick, you still shouldn't go someplace. Go get tested, stay at home until that test result comes back. If you're away, you get sick, don't interact with others. You don't want to try to get somebody else sick either. If you're away and you're interacting with people, is it okay still to use a mask indoors? You don't know what someone else's vaccine status is. That's not unreasonable. There are still ways to protect yourself and to protect others. And there's just some behavior changes, when you're meeting someone, keeping a little bit of a distance. So there's some individual risk assessments people can do, when they're duly vaxxed and they're traveling or they're going to do things to try to protect themselves. So some of those, non-pharmaceutical interventions like wearing a mask indoors or outdoors if it's feasible, doing that distancing, avoid sharing food items, those are all important things one can do to mitigate that risk even if you are duly vaxxed.
And is the province collecting data and information in regards to COVID-19 long haulers? And if so, can you speak to the ongoing impact since now more than 57,000 Manitobans have tested positive since the start of the pandemic?
I don't have the details of that. I know there was some work done with pediatrics. I just don't have the details of that, and that's something we'd have to go back and see if we have some information on that.
From CTV, John.
Hello, Dr. Atwal. Thanks for taking our questions today. I just wanted to go back to something that you were talking about a little earlier. There is a segment of the population that is currently unvaccinated and perhaps unlikely to be vaccinated. Can you please tell us, how will the province manage outbreaks in the future, especially once restrictions are no longer in place?
So again, there's lots of Manitobans not vaccinated. There's lots of under 11-year-olds who aren't vaccinated. They're all throughout the province. There are some areas in the province where there's lower vaccine uptake, but we are seeing a slow incremental increase in vaccine uptake in those areas as well. So when we're dealing with outbreaks, outbreaks are dealt differently depending on the setting, depending on the nature of the outbreak. So, all that will be done by public health if there is an outbreak, if it's in a setting, a workplace, or let's say in a school or some other location. The specifics of that location dictate sort of how we manage that outbreak. Well, we're looking at targeted interventions going forward as well, bringing out testing a little bit more easily to individuals, bringing out vaccines as well in an outbreak situation. But all along here, even when we do know the vaccine status of certain areas or certain populations, we are still working towards getting those individuals vaccinated, and there's a lot more local efforts being done in relation to that as well.
Okay, thank you for that. Looking at the recent surveillance information, I see that there was one COVID case in Winnipeg that had 86 contacts. Is this worrisome or surprising to you? And does this perhaps speak to a feeling maybe that some people may have that they no longer need to take COVID precautions as case numbers are falling?
I don't know the details of that case. I mean, it's always surprising to see, 86 contacts. It all depends on the context, the situation here. But, again, if you are duly vaxxed, you are protected, but you still should limit some of those interactions and try to behave in a manner where, you're interacting not to the fullest degree with people to mitigate that risk. We don't want to be generating cases right now. We want our case numbers to keep coming down as more and more Manitobans get vaccinated. If you're unvaccinated, obviously 86, if this person was unvaccinated and became a case and had 86 contacts, that's a problem. Right? So that would have to be addressed somehow, and to learn about what that problem was, what the issue was. And there could be a lot of contextual factors here that we're just, we can guess on, but we don't know. And again, I don't know the particulars about this case as well. So again, going forward, I mean, being vaccinated is important. If you're not vaccinated, go get vaccinated. We're allowing more interactions with people, but it doesn't mean you have to maximize everything you do under the orders. You still go out and do the things that you love to do, prioritize some things, but try to still limit some of those interactions to help mitigate that spread ongoing.
From CHVN, Taylor.
Hi, good afternoon. We see right now the lowest uptake rate is in youth, and those under 12 can't be vaccinated. How is the province planning for this impact on camps right now and eventually schools?
How is the province planning on?
For the impact of no vaccinations or very few vaccinations for youth.
Yeah, so for the youth, let's say looking at those under 18, kindergarten to grade 12, daycares, et cetera, public health is working closely with education or working closely with families on how we're going to be managing this, when school starts, when things come out of summer in September. We haven't finalized anything yet, so we're still learning about what's happening. We're going to have more information coming in week by week. We have some ideas on how we're going to manage this. We want to share our ideas again with other provinces to see how they're going to manage it as well. And then, we should have some more definitive information on that probably in a few weeks' time. We haven't set anything in stone. So again, there's ongoing work being done with those stakeholders. And there's a learning process here for all the provinces as well. We're going to be sharing that information, see what the best route would be for Manitoba starting September.
And with the new orders that were just put in place, the Manitoba Camping Association isn't happy to see that they didn't really have a whole lot of changes for their industry when it comes to overnight camps, and group sizes not changing much. Can you just explain why?
So we changed a lot with these last orders. There's a lot more interactions being allowed. Every business essentially is allowed to open. Camps can occur. We said no to overnight camps because of that risk of having a lot of, let's say, unvaccinated individuals there. So we are working through, again, what the next stage can look like. And we are looking specifically at camps as well, just because you asked the question about camps. But our intent is to continue to open things up, as the vaccine rate continues to increase, as we get more people with single doses, more people with double doses. The intent is to, again, have the least amount of restrictions on Manitobans. But we do have to take into account impacts on acute care system. We have to think about what's going to happen, 1 to 2 months down the road as well. So the overnight issue had to do with risk. Having lots of people coming together on an overnight basis, on a regular basis, can pose risk, can cause a super spreader event to occur. And if those kids get infected, they go back to their families. There's a risk to each one of those households as well in that situation. So at the present time, when these orders change, we felt it wasn't appropriate for that to occur. But we're going to keep looking at the data and the information, and we'll see what happens in the future in relation to that.
And our final reporter today from the Winnipeg Free Press, Katie May.
Good afternoon, Dr. Atwal. I'm wondering if you can tell me more about the importance of contact tracing at things like outdoor gatherings and patios. We know that a lot of patios have become more crowded, and not every establishment is collecting contact information or allowing for social distancing. The orders don't appear to state that masking has to be required outdoors in those settings. So what's being done to minimize the risk from a public health perspective there?
So outdoors, it's always lower risk from a public health perspective. You know, we are allowing those who are vaccinated and unvaccinated to sit together outdoors as well in groups of 8 maximum. So there's still risk there, but it's a low risk situation. So, you know, we continue to look at the evidence, and we're going to continue to focus on the evidence and risk, and we're going to continue to, you know, provide those best recommendations for Manitoba and for Manitobans to continue to be able to open and to mitigate risk as well. So that's where it stands right now. You know, as time goes on, we'll see where risk takes us and what we can and can't do indoors and outdoors in locations like this as well.
Okay. I know you say you don't have an update yet on the province's modeling data, but just related to the question about long haulers, can you tell us what kind of planning is being done to address the health needs of people who continue to have long-term health effects of this virus, even as the Delta variant circulates?
You know, that's a great question. I don't have an answer to that. That might be a better question to ask Shared Health, and we'll see if we can get some information from Shared Health in relation to that.
Okay, thank you. This concludes our media briefing.